Good morning. So Instagram, I'm having some issues with my lighting today. So I'm early. I'm way early today because I have some appointments today, and my lighting this morning is awful on Instagram because it's 7 a.m. in Arizona and the sun is so bright that it's reflecting off the pool. And on Facebook you can't see it, but on Instagram you can see all the reflection above me, and that's totally putting me in the dark. And I've sat here for 10 minutes now trying to light myself for a 7 a.m. broadcast with absolutely no success. So Instagram, I'm a little dark this morning. I'm sorry. Facebook, somehow you got lucky. I don't know. This camera's different. So you know what? We're going to make it work. We're just going to broadcast anyway because that's just the way it's going to go. So here we are. So anyway, I'm here on a bright and early Friday morning. Still having my coffee, still waking up with horrible lighting on Instagram. So, oh well. But we're going to talk about a topic today that maybe you haven't heard much about. So I'm excited to talk about it. We're going to talk about the surprising link between dementia and gum disease. Yeah, brushing your teeth is not simply about good breath. It's about your health overall. And in fact, brushing your teeth and having, mouth bacteria have been linked to more than just memory loss. But more recently, they're finding a lot of links to memory loss. Isn't that crazy? So I want to talk to you a little bit about that research, because when I read it, I was like, wow, okay, this is cool. We spent a lot of time trying to find medications to fight disease, when really something as simple as brushing your teeth might be able to help, or will be able to help. And then I also have some natural solutions, some other things you can do to also help with your oral health. So, we worry a lot about cognitive diseases. I think most people, when you forget something, think, oh no, are we starting this dementia train? And, I come home, I forget my alarm code, or someone asks me a phone number and it just doesn't come to me, or like somebody's name, I'm looking right at them and I know exactly who they are and it doesn't come to me. And you think, gosh, am I losing it? What's happening? So I always like to talk about the things that can impact your brain and cause brain fog, and dental health is one of those, okay? Now, I'm not a dentist. I should have brought a dentist on today. I'll work on that. That would be kind of fun, but I didn't bring one on today, probably because it's 7 a.m. and I'm still waking up and just thought of that right now. So we've talked about dementia before, we've talked about brain fog, we've talked about healthy diets and ways to reduce brain fog in general. So let's talk about the link with oral health, okay? So for years, we've heard about this link with oral hygiene or poor oral hygiene and disease. In fact, the American Medical Association officially recommended that all Americans brush their teeth for at least 2 minutes each day to lower our risk of developing cardiovascular disease, because they were finding that cardiovascular disease and bacteria in the mouth were highly linked, okay? So this recommendation was based on numerous studies, all right? And the findings were so strong that they still research it regularly today. So this is a big topic of research. A 2018 study revealed that the presence of gum disease, which is a chronic inflammatory disorder of the tissues that surround all your teeth, okay, is linked to higher systolic blood pressure, okay? They also found that having gum disease raises your blood pressure by about 2.3 to 3 mmHg. So if you're normally at 120, you could be at 122 or 123. Now that may not make a huge difference when you're in normal range, but if you're on that borderline, like most of the Americans, where your systolic is in the 140s and that bumps you up, that's a big significant difference. But there was also more. They found that severe gum disease was associated with unsuccessful hypertensive treatment, meaning that they would take the medication and their blood pressure would not go down. Okay, so huge link there. But now they're finding that there's another impact of gum disease. It's on your brain. Yeah. The truth of the matter is that scientists have found a clear link between Alzheimer's and gum disease, okay? This new study has revealed that a bacteria that causes gingivitis, okay, which is like a real mild, like when your gums just kind of, like before you get a teeth cleaning and your gums are just kind of irritated, that's essentially gingivitis, right? The tartar and the plaque build stuff up, and we can get a little bit of normal bacteria in our mouth that brushing our teeth gets rid of. But they're finding that it can move from the mouth to the brain, and it is now present in people with Alzheimer's in their brain. So the bacteria from the mouth is being found in their brain. Right? Crazy. In 2019, researchers studied 53 people with Alzheimer's and discovered an unquestionable link between Alzheimer's and gum disease. Okay, they found that a toxic enzyme released from the bacterium gingipain, which is the bacteria that causes gingivitis, was located in the brains, listen to this, of 51 of the 53 patients. That was 96% of the study group had it in their brain. 96% people. Wow, right? That's crazy, right? Okay, so interestingly, the researchers took it further, okay? And they designed a molecule to inhibit the bacterium. And they discovered that when the gingipain was inhibited, it reduced the infection of the bacterium in the brain, reduced brain inflammation, and even rescued neurons in the hippocampus, which is the part of the brain that can be impacted. So, wow. Okay, so taking care of your gums is essential to brain health, okay? Now, the study's authors did note that the bacterium does not single-handedly cause Alzheimer's, okay? There's other factors involved, but its presence increases your risk substantially and may actually progress the disease faster, okay? They also stated in an interview that regular oral care, such as brushing your teeth, using floss, are the two things that you can do that would help slow the progression of Alzheimer's. Okay, I don't know, I'm a parent, right? I have kids. It's all I can do to get them to brush their teeth. I don't know why. Because they don't understand this, right? When you get older, you're like, oh my God, yeah, I gotta brush my teeth. Like, we worry about our health. But if we could start those habits younger in life, maybe we could find a connection there. Maybe that's another way, that something we can do that's preventative that may help our kids, right? But I still have more. Woohoo, grab your coffee. Okay, other researchers are also now chiming in, and the authors of a 2020 scientific review stated, now this is this year, okay, we're not even that far into this year, oral health care is a key factor for the prevention or delay of conditions associated with oral microbiota dysbiosis, such as Alzheimer's disease, okay? So this is a big deal. Have any of you heard of this before? I know a couple of you are saying, yeah, I've heard of it, but when your gums get swollen and inflamed, that causes disease. And there's another link too, and something to consider. I think these studies are cool because they actually found the bacterium in the brain, but keep in mind that those with cardiovascular disease also have higher risks of Alzheimer's. So, if the bacteria are also impacting the heart, that's a double whammy right there. So definitely oral health is very, very, very important. So there are some things that you can actually do to help take care of your teeth outside of simply brushing and flossing. And of course, we all want to brush and floss, right? That's important. Get regular dental cleanings. Those are things that are always important. You guys kind of disappeared on me. Did you go? Oh, there we go. Hi, Becky. You've never heard of this, right? Yeah. I'm one of those people that just kind of sits and reads studies and just kind of, peruses and sees what I find, and the wealth of information on this subject in the medical community is unbelievable. I mean, it is there, and it is well documented, and it is ongoing research, and it's something that I'm just going to keep following because it's just really cool, right? So you got some stuff talking about CRP and inflammation. Yeah, CRP is also, as you were saying, I was talking about how heart disease can cause Alzheimer's. poor oral health, and also inflammatory markers, right? Which is what we talk about regularly here on this little live. We talk about how inflammation causes disease. Well, gum inflammation is inflammation, so it makes sense, okay? So there are a couple things you can do. Let me give you some tips here, okay? First of all, have you ever heard of oil pulling? I don't know. It sounds a lot harder than it actually is. So oil pulling is very simple. Okay, and basically you take about a tablespoon of oil. Now I like coconut oil, but it doesn't have to be coconut oil, and in colder climates you may not be able to do that because it solidifies, but coconut oil, and you swish it around in your mouth. Now listen to this is the important part. You have to do it anywhere from 5 to 10 minutes. That's a long time, right? So that's doing it kind of like a mouthwash. You're swishing it around your mouth, let's say for 5 minutes, and then spitting it out, okay? Sounds like a lot of work. Sounds kind of crazy, but coconut oil contains antibacterial properties that can help fight the bacteria in your mouth that causes harmful plaque, which leads to gum disease. And in fact, a 2016 study on 60 participants revealed that when the participants rinsed their mouths with 2 teaspoons of coconut oil for 10 minutes each day for 2 weeks, they significantly reduced the amount of harmful bacteria in their mouths, okay? They also noted, the researchers noted, that because oil pulling has no side effects, it should be considered part of our preventative home routine, right? So I have some homework for you. Try it. Let me know how it goes, you know? I'd really like to know. I'll be doing my oil pulling tonight. Yes, before bed. On that note, there are some, there are a lot of, and I don't want you to do this part without talking to a doctor or an herbalist, but there are a lot of herbs that also have antibacterial effect. In fact, oil of oregano has that impact. So some people also add like a drop of some sort of essential oil or some sort of oil to it. Now there used to be a capsule that I would use that had a combination of oregano, clove, and thyme oil in a little capsule, and you would just bite on it, swish it around, and then some people would swallow it and some people would spit it out. Now, since the oil pulling, you're spitting it out, you're not taking this internally, so that can help, but a lot of people add like a drop of oregano oil due to the antiviral and antimicrobial effects of oregano. There are other ones as well, like thyme, clove, but there was oregano oil has been proven to have antibacterial properties that can help tackle this type of mouth bacteria. It's also known to help the immune system, help with fungus, reduce the effects of some allergies, and act as an antioxidant. So just a tiny little dose of oregano oil in that oil pulling can really help kill off bacteria, particularly in those that may have a lot of extra bacteria in there. Now, as I'm sure you could guess, my third tip, if you had oil pulling, we had adding some antimicrobial herbs, of course, is probiotics. Now, there's been tons of studies on taking probiotics and improving the oral flora in the mouth. Okay, so that's pretty well documented. Now, I think most of these came from you taking it orally. I just have a suggestion for you that I've just done on my own, and I don't know. We'll see if it makes much of a difference. I don't have a study to back this one up. But what I often will do is take probiotics in a little bit of water and swish them around in the mouth first before I swallow them, just to get them locally on the gum tissue before I swallow them. So you can try that as well. But they have shown that taking probiotics that contain lactobacillus help treat periodontal disease, gingivitis, periodontitis, and pregnancy-induced gingivitis. On top of that, more recent studies have shown that probiotics can actually decrease gum bleeding. In fact, the participants who took probiotics, and this was just them taking it orally, saw a significant decrease in plaque formation in as little as 2 weeks. Okay, so great tips for you. Oil pulling, probiotics, maybe add some antimicrobial herbs, and take good care of your teeth. Pay attention to your teeth because they make a difference in your entire system. I have some questions over here. Let me see if I can take them before I head out. Where do I get my essential oils? You know, I get them in many places. It kind of depends. There are people that do sell therapeutic grade oils. We have some great health food stores around here that carry really high quality essential oils. It's really about making sure that it is truly a therapeutic grade essential oil, and it usually says that on the bottle. So, you know, don't buy it at Costco, okay? Like, that's not where you get essential oils. You don't get big bottles of essential oils, okay? You get little ones, and they're usually anywhere from $10 to $30, some even $40, depending on the herb, and they're in little bottles, okay? They're expensive. They can be expensive, but keep in mind you only use a drop here or there, so they last a long time. Thoughts on tongue scraping? You know, I didn't come prepared with any research on tongue scraping. I know a lot of people talk about it as helpful just to scrape the bacteria off. You know, for me, I would think brushing it also makes a difference. I don't know if you necessarily would have to scrape it afterwards, but I don't know. I'll have to look. I'll have to look up if there's any particular really strong research on tongue scraping and health conditions. I could imagine that killing off the bacteria in the mouth is really what's most important. So that would be removing, you know, stuff off the tongue, but I would also probably still do the oil pulling and obviously brushing the teeth with it, because you got to kill off all that bacteria. So that would be kind of my general layman's approach. I'm not a dentist. Didn't study teeth really outside of just the anatomy and knowing the connection between the bacteria and certain health conditions. But yeah, anyway, so hey, it was early today, but so nice to see so many people up early with me. Many of you are probably in totally different time zones. And as I deal with this new lighting crisis at 7 a.m. with everything coming off my pool, I'll do another one early sometime, but hopefully not soon, because I still haven't finished my coffee and I'm tired. So, for those of you that just joined, I'm sorry you missed the whole broadcast. I'm up early today. We talked about Alzheimer's and the link between gum disease and things that you can do to kill off those bacteria so they don't make it to your brain. So I am Dr. Tricia Pingel, and this is your morning checkup, and I will be back Monday at my usual time, around 9:15, 9:30 Pacific Standard Time or Arizona time. This was an anomaly. But for those of you that missed it, I am rewatching it, or I'm reposting it. So I'm gonna go do that real quick. And I hope you guys all have a great Friday. I'm excited for the weekend. Woot woot, weekend. So, all right, you guys have a great day. Thanks so much for joining this morning. Bye-bye now.